Top 25 Nurse Assistant Interview Questions and Answers. Preparing for a nurse assistant interview requires demonstrating your skills, compassion, and ability to handle real-world scenarios. Below are 25 carefully crafted questions with detailed answers, each approximately 100 words, to help you showcase your expertise and dedication to patient care. These responses highlight technical proficiency, empathy, and teamwork, tailored to the demands of the role. Whether you're a seasoned professional or new to the field, these answers provide a strong foundation to articulate your qualifications confidently. 1. Why did you choose to become a nurse assistant? I chose to become a nurse assistant because I have a deep passion for helping others and making a tangible difference in their lives. Caring for people during vulnerable moments is both meaningful and fulfilling. The role allows me to provide hands-on support, build connections with patients, and contribute to their well-being. I was inspired by witnessing compassionate care during a family member's hospitalization, which motivated me to pursue a career where I could offer comfort and assistance. Becoming a nurse assistant aligns with my values of empathy, service, and dedication to improving the quality of life for others. 2. What do you find most rewarding about working as a nurse assistant? The most rewarding aspect of being a nurse assistant is forming meaningful connections with patients and seeing the direct impact of my care on their well-being. Whether it's helping a patient regain confidence in daily tasks or providing emotional support during tough times, these moments are incredibly fulfilling. Knowing that my efforts contribute to their comfort and recovery brings a sense of purpose. Additionally, the gratitude expressed by patients and families reinforces the importance of my role. Being part of a healthcare team that collaborates to improve lives makes every challenge worthwhile and deeply rewarding. 3. Can you describe your experience working with patients in a healthcare setting? I have 2 years of experience as a nurse assistant in a long-term care facility, where I provided daily care to elderly patients with chronic conditions. My responsibilities included assisting with mobility, personal hygiene, and feeding, as well as monitoring vital signs. I worked closely with nurses to ensure patients' needs were met promptly. I've cared for patients with diverse needs, from those with dementia to post-surgical recovery cases. These experiences taught me patience, adaptability, and the importance of compassionate communication, enabling me to build trust and provide high-quality care in various healthcare settings. 4. How do you handle a patient who is uncooperative or agitated? When handling an uncooperative or agitated patient, I remain calm and empathetic, recognizing that their behavior may stem from fear, pain, or confusion. I approach them with a gentle tone, actively listen to their concerns, and validate their feelings to de-escalate tension. For example, I once calmed an agitated patient by engaging them in a conversation about their favorite hobby, which redirected their focus. If the situation persists, I seek assistance from a supervisor or follow facility protocols. My priority is ensuring the patient feels safe and respected while maintaining a professional demeanor. 5. What steps do you take to ensure patient safety and prevent accidents? To ensure patient safety, I follow strict protocols, such as verifying patient identities before procedures and maintaining a clutter-free environment to prevent falls. I use proper body mechanics when assisting with transfers and ensure equipment like wheelchairs is secure. Regular monitoring for changes in condition allows early intervention. For instance, I once noticed a patient's unsteady gait and reported it, preventing a potential fall. I also adhere to hand hygiene and infection control practices. By staying vigilant, communicating with the healthcare team, and educating patients on safe practices, I prioritize their safety and well-being. 6. How do you prioritize tasks when caring for multiple patients at once? Prioritizing tasks for multiple patients involves assessing urgency and patient needs. I begin by reviewing care plans and identifying critical tasks, such as administering medication or addressing acute conditions. For example, a patient with a scheduled wound dressing change takes priority over routine tasks like tidying a room. I use time management skills to create a mental checklist, ensuring timely care while remaining flexible for emergencies. Communication with the healthcare team helps delegate tasks when needed. This approach ensures all patients receive prompt, quality care while maintaining efficiency in a busy environment. 7. Can you explain how you maintain patient confidentiality? Maintaining patient confidentiality is critical to ethical care. I adhere to HIPAA guidelines by discussing patient information only with authorized personnel in private settings. I ensure medical records are securely stored and never share details outside the care team. For example, I once overheard a colleague discussing a patient in a public area and discreetly reminded them to relocate the conversation. I also log out of electronic health systems after use and avoid discussing cases in non-secure environments. By respecting privacy, I build trust with patients and uphold professional standards in all interactions. 8. What is your experience with taking and recording vital signs? I have extensive experience taking and recording vital signs, including blood pressure, pulse, temperature, and respiration rates, in both hospital and long-term care settings. Using manual and electronic equipment, I ensure accuracy and promptly report abnormalities to nurses. For instance, I once identified an elevated heart rate in a patient, which led to early intervention for a cardiac issue. I document vitals clearly in electronic health records, double-checking for accuracy. My training and attention to detail allow me to perform these tasks efficiently, contributing to effective patient monitoring and timely medical decisions. 9. How do you assist patients with activities of daily living, like bathing or dressing? Assisting with activities of daily living, ADLs, requires patience and respect for patient dignity. For bathing, I ensure privacy, use warm water, and provide gentle assistance while encouraging independence when possible. For dressing, I help patients choose comfortable clothing and assist with tasks like buttoning or putting on shoes, using adaptive tools if needed. For example, I once helped a stroke patient regain confidence in dressing by breaking tasks into manageable steps. I communicate calmly, assess their comfort, and follow care plans to promote safety and autonomy while maintaining a compassionate approach. 10. Describe a time you worked as part of a healthcare team. What was your role? In a nursing home, I collaborated with nurses, physical therapists, and dietary staff to care for a patient recovering from hip surgery. My role as a nurse assistant involved assisting with transfers, monitoring vital signs, and ensuring the patient's room was safe and accessible. I communicated the patient's progress and concerns, such as discomfort during movement, to the team, which helped adjust their therapy plan. By coordinating with the team, I ensured consistent care, contributing to the patient's successful recovery and improved mobility, demonstrating the importance of teamwork in achieving positive outcomes. 11. How do you handle a situation where a patient refuses care or treatment? When a patient refuses care, I approach them with empathy, seeking to understand their reasons, which may include fear or discomfort. I calmly explain the importance of the care while respecting their autonomy. For example, I once persuaded a patient to accept a bath by offering to proceed at their pace and ensuring their comfort. If refusal persists, I document the incident, inform the supervising nurse, and follow facility protocols. My goal is to build trust, address concerns, and find alternatives that align with the patient's preferences while prioritizing their health. 12. What infection control practices do you follow to prevent the spread of disease? I follow strict infection control practices, including frequent hand washing with soap and water or sanitizer before and after patient contact. I wear appropriate personal protective equipment, PPE, such as gloves and masks, based on the situation. I ensure proper disinfection of equipment and surfaces, like bed rails, after use. For example, during a flu outbreak, I diligently used PPE and isolated contaminated linens to prevent spread. I also educate patients on hygiene practices when appropriate. By adhering to CDC and facility guidelines, I minimize infection risks and maintain a safe environment for patients and staff. 13. How do you communicate effectively with patients who have difficulty speaking or understanding? Effective communication with patients who have difficulty speaking or understanding involves patience and adaptability. I use clear, simple language, maintain eye contact, and observe nonverbal cues. For patients with speech impairments, I employ tools like picture boards or writing pads. For example, I once used a communication board to help a stroke patient express their needs, improving their comfort. I also involve family members to understand preferences when appropriate. By listening actively and using alternative methods, I ensure these patients feel heard and understood, fostering trust and effective care delivery. 14. What would you do if you noticed a change in a patient's condition? If I notice a change in a patient's condition, such as altered vital signs or behavior, I immediately assess the situation and document specific observations, like increased confusion or shortness of breath. I promptly report the change to the supervising nurse or physician, providing clear details to ensure timely intervention. For example, I once noticed a patient's sudden pallor and reported it, leading to a quick diagnosis of anemia. I continue monitoring the patient while awaiting instructions and ensure their safety. Clear communication and vigilance are key to addressing changes effectively. 15. How do you manage stress in a fast-paced healthcare environment? Managing stress in a fast-paced healthcare environment involves effective time management and self-care strategies. I prioritize tasks based on urgency and maintain a calm demeanor to stay focused. For example, during a busy shift, I use brief breaks to practice deep breathing, which helps me recharge. I also communicate with my team to delegate tasks when necessary, ensuring patient care remains efficient. Outside work, I engage in exercise and hobbies to decompress. By staying organized, seeking support, and maintaining a positive mindset, I handle stress while delivering compassionate, high-quality care to patients. 16. Can you provide an example of a time you went above and beyond for a patient? During a shift, I noticed an elderly patient seemed withdrawn and missed their family. Beyond my routine duties, I spent extra time engaging them in conversation about their favorite memories, which visibly lifted their spirits. I also coordinated with the social worker to arrange a video call with their family, as they lived far away. This small gesture brought the patient immense joy and strengthened their emotional well-being. Going above and beyond means recognizing a patient's emotional needs and taking initiative to provide comfort, enhancing their overall care experience. 17. What experience do you have with medical equipment, like wheelchairs or lifts? I have extensive experience using medical equipment like wheelchairs, Hoyer lifts, and gait belts in a long-term care facility. I'm trained in safely transferring patients using lifts to prevent injury, ensuring proper sling placement and weight distribution. For example, I regularly assisted a patient with limited mobility using a Hoyer lift for safe transfers to and from bed. I also ensure wheelchairs are adjusted for comfort and safety, checking brakes and cushions. Routine maintenance and cleaning of equipment are part of my practice to ensure functionality and patient safety. 18. How do you ensure accurate documentation of patient care? Accurate documentation is critical for continuity of care. I record patient information, such as vital signs, ADLs, and observations, in real time using electronic health records or paper charts, ensuring clarity and precision. I double-check entries for errors and use specific, objective language, like noting patient ate 50% of meal, instead of vague terms. For example, I once caught a typo in a patient's fluid intake record and corrected it promptly. I also follow facility protocols and seek clarification if unsure, ensuring documentation is reliable for the healthcare team's decision-making. 19. Describe a time you dealt with a difficult family member of a patient. How did you handle it? I once encountered a family member upset about their loved one's slow recovery. I listened empathetically, acknowledging their concerns without taking it personally. I calmly explained the care plan and the patient's progress, ensuring transparency. I also involved the supervising nurse to provide further clarification and offered to arrange a meeting with the care team. This approach diffused tension, and the family member appreciated the open communication. By staying professional, patient, and collaborative, I addressed their concerns while maintaining focus on the personally. I calmly explained the care plan and the patient's progress, ensuring transparency. I also involved the supervising nurse to provide further clarification and offered to arrange a meeting with the care team. This approach diffused tension, and the family member appreciated the open communication. By staying professional, patient, and collaborative, I addressed their concerns while maintaining focus on the patient's well-being, fostering trust and understanding. 20. What do you know about caring for patients with specific conditions, like dementia or diabetes? Caring for patients with dementia involves patience, clear communication, and a calm environment to reduce agitation. I use consistent routines and engage them in familiar activities. For diabetes, I monitor blood sugar levels, ensure timely meals, and watch for signs of hypo or hyperglycemia, reporting changes immediately. For example, I assisted a diabetic patient by coordinating meal times with insulin administration. I stay informed about their care plans and collaborate with nurses for tailored interventions. Understanding these conditions allows me to provide compassionate, proactive care while addressing their unique physical and emotional needs. 21. How do you stay updated on best practices in patient care? I stay updated on best practices by attending in-service training sessions, reading healthcare journals, and participating in workshops offered by my facility or professional organizations. I also follow guidelines from sources like the CDC and review updates on infection control or patient safety. For example, I completed a recent course on fall prevention techniques which I applied in my work. Engaging with colleagues and nurses during team meetings provides insights into new approaches. By staying proactive and curious, I ensure my skills align with current standards, enhancing the quality of care I provide. 22. What would you do if you made a mistake while providing care? If I made a mistake while providing care, I would immediately assess the situation to ensure patient safety and address any harm. For example, if I administered the wrong dosage, I'd report it to the supervising nurse and follow facility protocols, including documenting the error accurately. I'd reflect on the cause, such as misreading a chart, and take steps to prevent recurrence, like double-checking orders. Transparency is key, so I'd communicate openly with the healthcare team. Learning from mistakes through self-reflection and additional training strengthens my practice and prioritizes patient well-being. 23. How do you build trust and rapport with patients? Building trust and rapport with patients starts with active listening and genuine empathy. I introduce myself, maintain eye contact, and use a warm, respectful tone. I take time to learn about their preferences and interests, which helps personalize care. For instance, I built rapport with a patient by discussing their favorite music, making them feel valued. Consistency in care, keeping promises, and respecting their dignity further strengthen trust. By addressing their concerns promptly and showing compassion, I create a supportive environment where patients feel safe and understood, enhancing their care experience. 24. What strategies do you use to maintain a clean and organized patient environment? Maintaining a clean and organized patient environment involves regular tidying, disinfecting surfaces, and ensuring equipment is properly stored. I follow infection control protocols, such as cleaning bed rails and call buttons after use. I organize personal items to prevent clutter, reducing fall risks. For example, I once rearranged a patient's room to ensure clear pathways for safe mobility. I also check linens and supplies daily, restocking as needed. By maintaining a neat, hygienic space, I promote patient comfort and safety while adhering to facility standards, creating a positive environment for recovery and well-being. 25. Why do you want to work for our facility, and how do you see yourself contributing to our team? I'm drawn to your facility's reputation for compassionate, patient-centered care, which aligns with my values. I admire your commitment to staff development and quality outcomes. As a nurse assistant, I'd contribute by providing attentive, empathetic care, ensuring patient safety, and collaborating with the team to meet care goals. My experience in long-term care equips me to handle diverse patient needs efficiently. I'd actively participate in team efforts, share insights, and support a positive work environment. By bringing dedication and professionalism, I aim to enhance patient experiences and support your facility's mission. These 25 questions and answers prepare you to confidently showcase your skills, compassion, and professionalism in a nurse assistant interview. By emphasizing patient-centered care, teamwork, and adaptability, you can demonstrate your readiness for the role. Practice these responses, tailoring them to your experiences to highlight your unique strengths. Approach the interview with confidence, knowing your dedication to improving patients' lives will shine through. Good luck in your interview. You've got this.